Good afternoon, dear patients. Today we will discuss a clinical case, as shown in the picture. A patient came to see me, a young man whose glans penis had become swollen. It became slightly painful, especially in the area of the frenulum, and a hardening appeared on the glans penis. You can see this accordingly in the picture. Upon examination, the glans is slightly enlarged. It is redder than normal. And well, next to the frenulum, a dense cord can be felt, which is slightly painful. The inguinal lymph nodes are not enlarged. What was going on with this patient? This patient, he initially came in with ureaplasma. According to him, there were minor discharges. He went to the clinic to see a urologist. At first, he was prescribed doxycycline. Then, after this doxycycline treatment, swallowing, so to speak, the capsules, he got checked again 2 or 3 weeks later, and the ureaplasma was still there. Then he went to the same doctor again. This time he was prescribed azithromycin. Well, after starting azithromycin, a few days into the course, this event occurred. So, what was observed externally? Well, externally you can see swelling of the lymphatic vessel. This most often appears in the coronal sulcus. It's relatively difficult to photograph there because the tissues are soft. Here, I managed to make it clear that it was specifically the lymphatic vessel that became inflamed. What causes this? Well, first of all, it can happen due to trauma, among other things. But in this patient's case, that's not the cause. By the way, what is lymphangitis of the penis? You can watch a more detailed separate video about it on our channel. Right now, we won't focus too much on that. And what causes it in general? Let's look specifically at this patient. Well, naturally, the vessel was inflamed. In this case, the cause was determined to be a toxic-allergic reaction from taking antibiotics. Basically, people nowadays tend to do this. They often don't even go to the doctor for it. They read all sorts of dubious things on the internet and accordingly take various medications, which, in my opinion, is extremely wrong. At the very least, for ureaplasma, you should at least do a sensitivity culture, not just take whatever comes to hand at random. In this patient's case, of course, the justification is that he really did go to the doctor and it was prescribed by a physician. However, general approaches do not always work, especially lately, considering that the antibiotics I mentioned earlier, if you look at when they started being used, it's been 20 years already, if not more. Therefore, naturally, their effectiveness is quite poor. In this patient's case, diagnostics were performed first. Again, PCR tests were taken from the penis. He stopped taking azithromycin a day ago. Tests for ureaplasma were taken from the penis. It was detected there at that time. Next, allergy tests were performed. His immunoglobulin E was slightly elevated, as was the circulating immune complex. This indicated a kind of allergic reaction to the treatment. And of course, these tests are almost never done before treatment. Although, to be fair, it should be noted that these tests are not always performed, and there are no direct indications for them if the patient has not previously had an allergy to medications. Therefore, the swelling can be regarded as more likely a toxic-allergic reaction of the penile vessel to the treatment being administered. Of course, we cannot rule out the involvement of ureaplasma in the inflammation of the lymphatic vessel. Here, we have to wait and see how things unfold. To begin with, this patient was prescribed detoxification therapy in addition to discontinuing the previous treatment, including sodium sulfate, calcium gluconate, antihistamines, and intestinal sorbents. Anti-inflammatory drugs, such as Voltaren injections, were also prescribed. Additionally, vascular medications were prescribed for topical use. However, prescribing too many medications is not good either, so the treatment was limited to these 3 or 4 drugs for the time being. After that, the lymphatic vessel gradually returned to normal in about 7 to 10 days. The swelling of the glands gradually subsided. Also, by the way, cool compresses with the same furacillin were applied. After that, tests were ordered to determine the sensitivity of ureaplasma to antibiotics. And an appropriate course of treatment for ureaplasmosis in men was prescribed. You can watch a separate video on our channel for more details on this topic, again, so as not to make this video too long, about rinsing, injections, and antibiotics selected based on the sensitivity of ureaplasma to therapeutic drugs. And with the correct course of treatment, combined with anti-allergy pills such as Tavegil, Suprastin, and others, such inflammations of the lymphatic vessel were not observed during treatment. This case shows that under no circumstances should you take pills without proper testing. All the more so, you shouldn't avoid seeing doctors and engage in self-medication, as this only serves to make the condition chronic, so to speak, and leads to such complications.